Good afternoon. My name is João Nunes. I have a PhD in biophysics, and I would like to present a new solution for diagnosing HIV, which is called NanoV. We have a small problem. Not anymore. So, diagnosing early HIV is extremely important. Currently, the vast majority of people actually die from HIV are actually those who are diagnosed late. It is fairly well established that diagnosing HIV is extremely important for preventing infection, and it's extremely important to actually have a better outlook when you go under treatment. And right now we actually have more solutions more widely available. Still, it is the deadliest contagious disease, killing 1.6 million people every year. And it is still infecting each year 2.1 million people. So why does this happen? Still current tests for HIV are expensive. They can actually cost up to 300 euros. They are slow. According to current CDC protocols, you actually will have to wait between 4 to 8 weeks to get a proper diagnosis. And they are complex, they are cumbersome. They actually often require multiple tests, and these tests need to be performed by specialized staff. Our solution is called NanoV. And NanoV is a biosensor that works very easily. You get a small sample of blood that you can get from pricking your finger. You actually apply this blood to the biosensor, and a reader will actually tell you if you are infected or not in a matter of minutes. And this test can actually detect HIV unprecedentedly early. We can actually get it 3 days after you suspect that you had an infection. It is a standalone point-of-care test, which means that we actually do not need specialized staff. And it is fast and it is accurate. So how can we actually do this? Let me dissect a little bit our biosensor. Our biosensor is actually a cartridge that includes a biosensor itself and a chip that does the interface towards our reader. And the way we do this is that we make use of nanowires, which are wires that are so small you can actually fit quite a lot in a very small volume. And just for you guys to actually have an idea of how small they are, here's a strand of hair. And in red, there's actually a nanowire on top of it. And in such a strand of hair, you can actually fit 50,000 of these nanowires. These nanowires are actually in the same range as viruses. So, what is so special about our nanowires? Daila actually has an algorithm that allows us to create custom-made proteins from which we can actually do protein-made nanowires. And these nanowires are actually quite interesting because we can make them in a way that we can bind very specific probes made out of DNA that target HIV and therefore are quite sensitive. And so the way this test actually works, let's imagine that you actually apply a sample that is infected with HIV, a blood sample. What happens is that the virus will be detected by these ultrasensitive sensors, and the reader will actually tell you if you're HIV infected or not. And we actually blow the competition away. This is a test that can diagnose HIV as early as 3 days. It's a very fast test, as fast as the fastest ones that we have. And it is as accurate as the most accurate test in the market. And it's actually also the cheapest option, and let me show you why. Currently, if you suspect that you're infected with HIV, 15 days after that you can actually start doing antibody testing. If you test positive, you actually have to do confirmatory tests first through an Western blot, so you can know if you are HIV-1 infected or HIV-2 infected. If you still cannot sort this out with this test, you actually have to do this genetic testing. And on the off chance that you actually are negative in the first antibody exam, you will have to do a second 15 days afterwards. And this can actually surmount to up to 400 euros in costs. NanoV comes in day 3. It costs 110 euros, and you don't need any other test. NanoV is actually the option. It replaces all other tests. So the HIV market currently is 3.6 billion worldwide. And what we want is to convert this market to NanoV market. We want to take it all. The geographical areas in which they do more testing is North America and Europe. And therefore, this will actually be our entry market. Both of them comprise 75% of the entire market. What Daila has as key activities, or wants to do as key activities, is actually research and development and product design. And you actually want to take the product to market, you want to do sales. However, the manufacturing will be fully outsourced. And we want to get to our final customers through well-established distribution lines. And our customers are mostly healthcare institutions, pharmacies, and drugstores. In terms of pricing, we actually will adopt the razor blade model, in which we will sell the reader for a smaller price in order to create fidelity to buy the biosensor and in order to have more purchases on the biosensor. And since we have to consider distribution, the distributor's price for the biosensor is 55 euros and for the reader 900, while the final price for consumers will be 110 euros and for the reader will be 1800. So, in terms of roadmap, research and development will occupy the first year and a half, in which afterward we'll undergo our proof of concept, which will culminate with patenting. Thereafter, we will undergo regulatory affairs for a medical device class 2. So afterwards, we can actually implement our sales strategy in terms of manufacturing and marketing. In terms of investment, we actually need 5 million. We expect to break even on the 5th year, and we expect revenues on the 8th year of 33.3 million. The team is composed by me and Pedro as the members of Daila, and we are assisted by the MBA student Rita Figueiredo, and our mentors guided through this process. NanoV is a test to replace all others. My name is Ron Wunsch. I'm here for any questions you may have.